My name is Nick Cecchi. I'm a PhD student in the Bioengineering department working under Dr. David Camarillo. And today I'm going to share a little bit about one of our recent studies that sought to identify factors associated with the magnitude of head impacts in high school American football using our lab's instrumented Mouthguard device. So American football is the most popular contact sport in the country with over 1 million participants at the high school level specifically. And repeated head impacts, even in the absence of diagnosed concussion, can lead to both acute and chronic neurological consequences in these athletes and other contact sport athletes, including neurodegenerative disease. In addition to the number of impacts that an athlete sustains, the magnitude of each individual impact as quantified by head kinematics, or the motion of the skull after sustaining an individual impact, has also been associated with an increased risk of diagnosed brain injury. So monitoring the magnitude of each individual impact that an athlete sustains in addition to the number of impacts is important when considering effective methods of monitoring athlete brain health. So our work in this study sought to identify sport-specific factors, or what kinds of impacts these athletes are sustaining, that are associated with the highest magnitude of head kinematics. So our lab has developed an instrumented Mouthguard device called the MCHRI 2.0, seen worn here in this photo. On the outside, it looks just like a normal mouthguard that athletes are required to wear during their practices and games. But on the inside, it features electronics, including an accelerometer and gyroscope for measuring linear and angular head kinematics. And for about the past decade, our lab has further developed this technology as well as validated it both in the lab and on the field. So in this study, we disseminated these devices to 4 local Bay Area high school football teams for a total of 116 participants. We monitored the athletes' player position, their helmet model, which helmets they were wearing, and the exact location of each impact they sustained. The Mouthguards, as I mentioned, measured the linear and angular head kinematics for each impact that was sustained. And then we fed those kinematics into a finite element brain model developed by our collaborators at KTH University in Sweden. And that gave us a better understanding of the estimated brain deformation or brain strain associated with each one of these impacts. So what we found after monitoring these athletes for 2 full seasons was there were 2 main things that were driving differences in the magnitude of head impacts. The first being that the first was the location of the impacts. So impacts to the back of the helmet, although they weren't the most frequent, were the highest in magnitude. So these impacts are going to be the ones that athletes are unsuspecting and not ready to fully brace themselves for. And also these impacts to the back of the helmet often happen when an athlete is tackled and their head strikes the ground, which is essentially like your head striking an infinite mass rather than striking another player. Also, we noticed that skill position athletes sustained impacts of higher magnitude than line positions. So skill positions, if you're familiar with American football, are like your wide receivers or quarterbacks who are going to be taking tackles or impacts at higher velocity than line position athletes like your linemen, who are sustaining impacts that are more characterized by close quarters contact. Now, something interesting that we did not observe was differences in helmet performance on the field. So between 2 of the main helmets that were worn by our athletes, the Visus helmet and the Rydell helmet, we found no significant differences in both the kinematics and the estimated brain strain of impacts. So what we're viewing here is 50th percentile brain images of our simulated brain strain from that finite element model for impacts in each helmet location category. And we can see again here, those impacts to the back of the helmet, regardless of helmet, were the most severe. So these blue areas are lower strain regions. Yellow is going to be your medium strain regions, and then red are your high strain regions. But between the 2 helmets overall, we found no significant differences in their performance. So this is interesting to us because the on-field performance that we observed in our high school athletes actually differed very much from previously published and widely publicized laboratory tests. So the NFL in 2018 released their helmet laboratory testing performance results. 2018 was the first year of data collection for this study. So this would have been the tests that athletes would have used to inform their helmet purchasing decisions. And we see the Visus helmet ranked number 2 here, was one of the main helmets worn by athletes. And all the way down at number 18 was the Rydell Speedflex, which is another one of the main helmets that our athletes wore. These are very far apart in helmet performance as estimated in laboratory testing protocols. And we think this is because these existing laboratory testing protocols are designed specifically based on the risk of concussion in the National Football League. The National Football League has about 2,000 players per year, and these are the highest of the high elite performing athletes. High school players are over 1 million athletes per year in the country, and a lot of these athletes have never played football before. So there's a really wide difference in how these helmets should be tested. So future directions that we're hoping to go based on what we learned is to develop setting-specific helmet testing protocols. So these would factor in skill level, whether your athlete is a high school, collegiate, or professional athlete, their player position, so skill and line positions, which we saw differed in head impact magnitude, and then also factor in various impact conditions. So really trying to focus in on where helmet technology can improve, such as those impacts to the back of the helmet. And I just want to say thank you to my PIs, Dr. David Camarillo, Gerald Grant, and Michael Zana, and also all of our lab members and collaborators and all the generous funding that we have received to push this research forward.
Thanks for that wonderful presentation. We are, I think, still waiting on questions, so I'll ask one question as we're waiting. So how do you envision modifying a helmet based on some of this data? Do you think we have enough data to start speculating, or do you think we would need more data?
More data is always better, but I think that this field of research has enough data right now to make some informed decisions. Specifically, one route that we're going in our lab is the use of liquid shock absorbers in helmets. These have been shown to be particularly effective, not just for mitigating impact energy for very severe impacts that would be more associated with risk of concussion, but also for those low magnitude impacts that athletes are sustaining on a day-to-day basis. So really what we're thinking an effective way to improve helmet design is to feature technologies that are effective at mitigating both low and high impact energies.
Wonderful. We do have one other audience question. So they say you showed brain strain differences. Is it possible to do fMRI correlates to determine long-lasting neurological effects of the brain strain?
That is a good question. We currently are not doing fMRI. We are currently doing MRI, both preseason and postseason for athletes. But I think that fMRI has been used in a lot of this research by other groups, specifically at Wake Forest University.